Today our topic of discussion is another cranial bone, that is the frontal bone. First I am telling you that in this part the bone is broken, so don't bother about it. Let's start with the frontal bone. It is one curved plate of pneumatic flat bone, and it is of a cockle shell shape, and it presents one vertical upper squamous part and one horizontal plate or the orbital plates. So this frontal bone is consisting of two parts, squamous part and the orbital plate. So let's start with the squamous part. Squamous part presents external and the internal surface and the parietal or posterior margin. On each side, the supraorbital margin, this supraorbital margin forms the junction between the squamous part and the orbital plate. You can see that this is the supraorbital margin and this is the junction between the squamous part and the orbital plates. And this supraorbital margin is concave and sharp in its lateral 2/3 portion and somewhat rounded and concave in its medial 1/3 portion. And in the junction between these two parts, that is the lateral 2/3 and medial 1/3, there is a foramen called the supraorbital notch or foramen. It is here, it is the notch, that is the supraorbital notch. If it is closed, then it is called the supraorbital foramen. Here you can see the supraorbital foramen. If I put the probe into this, you can see that it passes through this foramen. So this is the supraorbital foramen, and this transmits the supraorbital vessels and nerve. And more medially, there lies the supratrochlear vessels and nerve, which curl upward around the margin without forming any significant notch or foramen. Fine. So through supraorbital foramen transmits the supraorbital vessels and nerve. This is your supraorbital notch or supraorbital foramen, and more medially there curls around the supratrochlear vessels and nerve, and there is no significant notch or foramen. If we trace it more laterally, the supraorbital margin is continuous with the zygomatic process. If we trace it more laterally, it is continued as a zygomatic process, and the tip of this zygomatic process articulates with the frontal process of the zygomatic bone. This is a cheekbone or the zygomatic bone, and that has one frontal process, and the tip of the zygomatic process of frontal bone articulates with the frontal process of the zygomatic bone, and that forms the frontozygomatic suture. From this posterior margin of the zygomatic process, one line curves upwards and backwards, and it is continued on the parietal bone as the two temporal lines, as it splits into two, and this is called the temporal line. Below and behind this line, or that this temporal line forms the temporal surface of the squamous part of the frontal bone, and below this line, this area provides attachment of the temporalis muscle covered by the temporal fascia. Between these two supraorbital margins, the squamous part of the frontal bone dips as the nasal part, and it presents a serrated nasal notch at the lower margin, and this nasal notch articulates on each side with nasal bone frontal process of maxilla and the lacrimal bones. The point of intersection between these nasal notch with the nasal bone is known as the nasion, and that point, that is the nasion, is the interconnection between the frontonasal suture and the internasal suture. I am repeating it again, that this nasion is the point of interconnection between the nasal notch of the frontal bone along with the nasal bones. In other terms, you can say it that this is the interconnection between the frontonasal suture and the internasal suture. Okay, the nasal spine, another thing is nasal spine, it is not clearly visible here. Another thing is one spine, that is the triangular shaped process that extends downwards and forwards like this. Small spine extends downwards and forwards from the center of the posterior part of this nasal notch. Nasal spine articulates in front with the crest formed by the union of two nasal bones and posteriorly by the perpendicular plate of ethmoid. Now come to the external surface. Above each supraorbital margin there is some raised elevation, curved elevation. This curved elevation is called as the superciliary arches, and these superciliary arches are more prominent in case of adult males and less prominent in case of females. As you can see it here, that here in this bone these are not so much prominent, so it is basically a female bone. Medial ends of these two superciliary arches meet at the center, and this is called as the glabella, because at that point the two eyebrows meet, and at the center, that is the hairless or the glabrous, so that is the rounded prominence called as the glabella. Above these superciliary arches with a groove in between, there are two elevation or the prominence. These are called as the frontal tuber or the eminence. These are more prominent in children and in case of female. As you can see well that these frontal tuberosity or eminence are more prominent than these superciliary arches, so it is now proved that it is of an adult female. These frontal tuber or the eminence have some significance, because from this frontal tuberosity the ossification of the frontal bone starts, and just opposite or beneath the frontal tuberosity there lies the frontal pole of the cerebral hemisphere, and above this frontal tuberosity there lies the whole of the entire external surface is smooth, and it is covered by the frontalis muscle on both sides, and on the midline, on the intervening between those two frontalis muscle there lies the epicranial aponeurosis. So let's start with the internal surface. It is deeply concave and presents impression for the gyri of the cerebral hemisphere along with some meningeal vessels. There is a sagittal sulcus, as it is broken here, but below you can see that there is a sagittal sulcus which provides the attachment of the dural folds, that is the falx cerebri, and below, as it descends, the sagittal sulcus descends, it becomes more prominent and more sharp, and at that level this is called as the frontal crest. As you can see that here it is more prominent and the sharp. This frontal crest at its most downward position, there presents a blind foramen. This is called as the foramen cecum, and this foramen cecum has been formed due to the articulation of this frontal crest with the ala of the crista galli of the ethmoid bone. Come to the parietal or posterior margin, which articulates with the frontal border of the parietal bone and forms the one half of the coronal suture. Traced laterally, if we trace laterally or downwards, this parietal margin forms a triangular rough surface here. This is the triangular rough surface here. It forms because it is formed due to the articulation with the greater wing of sphenoid. So it is all about the squamous part of frontal bone. Next, start with the orbital plates. As I have told that orbital plates are horizontal plates, and it is a triangular curved plate of bone. It has one orbital surface, one cerebral surface, one posterior margin, lateral margin, and one medial margin, and these two orbital plates are separated by an U-shaped notch that is called the ethmoidal notch. This orbital plate has two surfaces. The orbital surface is smooth and concave and forms the major part of the roof of the orbit. Anterolaterally, there is a fossa or depression because of the lodgement of orbital part of lacrimal gland. That is why this is named as the lacrimal fossa. Anteromedially, there is a depression or spine. Sometimes there is a spine, but here it is a depression for the attachment of the pulley, fibrocartilaginous pulley through which the superior oblique muscle of eyeball passes and changes its direction. The supraorbital margin, this supraorbital margin also gives attachment to the superior tarsal plate of the upper eyelid, that is basically forming the orbital septum. Next, come to the cerebral surface. The cerebral surface of the orbital plate is convex and irregular. As you can see, this is irregular, not smooth like the orbital surface. The convex, irregular, and related with the orbital surface of the frontal lobe, and it forms a major portion of the anterior cranial fossa. Next, come to the posterior margin. This posterior margin articulates with the lesser wing of the sphenoid. The lateral margin is formed by the triangular rough surface, as I have shown you previously. This lateral margin articulates with the greater wing of the sphenoid. Next, the medial margin is broad. This medial margin is broad and articulates with the upper surface of the labyrinth of ethmoid bone, and there are two bony canals along the surface of the articulation of the ethmoid bone and the frontal bone. These are the anterior and posterior ethmoidal canal, and these two canals transmit the anterior and posterior ethmoidal vessels and nerves. Another important thing you have to show here, that the large frontal sinuses, one on each side. That the one large frontal sinus, and here one on each side. This is another, and this is another frontal sinus, and these frontal sinuses extend upward beneath the medial part of the superciliary arch, as you can see here. Frontal sinuses are usually absent or rudimentary at the time of the birth, and later on you will understand that how these frontal sinuses open into the middle meatus of the nasal cavity through the frontonasal duct, ethmoidal infundibulum, and the hiatus semilunaris. This ethmoidal notch, as I have told you that U-shaped ethmoidal notch intervening between the two orbital plates is occupied by the cribriform plate of ethmoid bone, and that cribriform plate of ethmoid bone presents numerous openings because of the passage of olfactory nerves. So now come to the anatomical position. How will you hold it? First, during holding it in an anatomical position, you have to keep 3 points in mind. That squamous part should be above vertical, orbital plates should be horizontal, and nasal spine will be here. Nasal spine should be anteriorly placed. So it is an unpaired bone, so you have to hold it with your both of the hands, and squamous part will be vertical upwards, orbital plate will be horizontally placed, and the nasal spine will be your anterior. So that will be your anatomical position of the frontal bone. Thank you.